Well, hello, friends. It's another opportunity to have some wonderful dialogue and conversation with Kidney Talks with the Ron and Joy Paul Kidney Center at George Washington University. I am your host, Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church in Washington, D.C. And I'm just excited about today's presentation and sharing. Actually, it's really more of a question and answer dialogue of unanswered questions from the second half of 2023. And I want to bring on our resident co-host and physician, Dr. Clive Callender, who is a wonderful, wonderful human being, but he's a professor of surgery at Howard University. And he's also the founder and director of MOTEP, which is the Minority Organ Tissue Transplant Education Program. And Dr. Callender, we're just so grateful that you're with us, and Happy New Year to you. And I can't wait to hear what you're going to say in reference to the unanswered questions in the second half of 2023.
I'm as excited to be here and to join you in that quest.
All right. Well, let's just jump right in. And, a lot has been for us to understand, and there's so much about our own bodies that we need to pay close attention to. And one of those things, indicators of our own body that we frequently go into the doctor and have checked is our blood pressure. And I wanted to just start off by asking you, well, Dr. Callender, what is a good blood pressure? Or what are the good numbers for good blood pressure reading?
That's a very interesting question, and it's been talked about for the last 5 years with a varying number of numbers given. But my assessment, after all is said and done, after you look at all of the studies, I think that if you've got a blood pressure that's less than 130 systolic, which is the top part of the number, and a diastolic blood pressure of 80 or below, that is the number to shoot for, especially if you're older. If you're younger, you might shoot for 120 over 80, and there are a number of studies that suggest that may be the number for younger people. But in general, I would say that 130 over 80 is the number you should shoot for. But I think one of the most important things about this blood pressure is who should be measuring the blood pressure. And one of the confusing aspects of it is a phenomenon called white coat hypertension.
Yes.
Which involves you going to the doctor, and when the doctor takes your blood pressure or the nurse takes your blood pressure is higher than it ordinarily is, which brings us to who really should be taking the blood pressure. And you know who that is? That's you.
We
You
should
be doing it at
Absolutely.
home. You should be doing it at home and doing it once or twice a week. And if it is above those numbers of 130 over 80 that I gave you, then you might see the doctor and then talk to him about how you could have it treated. And there are a number of ways of treating blood pressure. The first way is to lose weight. Next is to eat the right, healthy, appropriate foods. And eat small portions of those foods and have a normal weight. Then, of course, these are the basic things, but it starts at home. You having a sphygmomanometer, which is the term we use for the blood pressure apparatus, and you using that and taking it when you're home comfortably seating, because then you'll know what your real blood pressure is. Yes, going to the doctor and nurse getting the blood pressure is good as well, but the monitoring of it by you at home is what makes the difference. Because if you have high blood pressure and you know it and you take medication, but it's not controlled, what good is that? That doesn't matter. What does matter is that if you monitor yourself and you know that it's around 120, 130 over 80, and that's where it stays. Wonderful. If you find out you have high blood pressure and you're taking blood pressure medication and your blood pressure is still not controlled, then what's the merit? There is none. So when push comes to shove, we go back to the consideration that you should be monitoring your blood pressure yourself at home, and letting your doctor know how you're doing it, and then he can advise you as to whether you need more or less blood pressure medication. In many instances, sometimes all you need is to have the proper rest, the proper meditation, and cut out that salt and some of that sugar, and that would help a lot.
Well, you talked a lot about blood pressure, but I don't want to make it something that is folk to bypass something that they really look over. But so I want them to know a little bit more about it. And can you just tell us what the systolic number is, the top number, and the diastolic number is? What
Yes.
they really represent?
Okay. Well, when the heart beats, that pushes the blood out, and that's the top number. That's called systolic. That's
So
the
that's the
pressure
push.
of the heart pumping and sending out the blood at a high rate. Now, if that systolic is greater than 120, for example, one of the things that we don't talk much about is the difference of blood pressures between males and females. There's recent information that indicates that when the female has a high blood pressure, this is much more dangerous and increases mortality rates from strokes and heart attacks than if the male has a high blood pressure. And that pressure that is thought to be associated with mortality is a pressure that's 160 over 90. If anything like that for women is associated with more strokes and more heart attacks and more deaths. So monitoring that and keeping that. So in answer to your question, the top part talks about the way in which the blood, when it leaves the heart, is pumped out. And that, if it's high, it damages the blood vessels and causes arteriosclerosis, hardening of the arteries, which affects the kidneys, the hearts, and all of the body parts. And then the diastolic, on the other hand, the second part of it, is that pressure is when after you pump the blood out, then the pressure that exists thereafter, so that when the blood returns to the heart, you have a relatively lower pressure. So you have the systolic, which is when the heart puts it out, and the diastolic, which is kind of when the lower number when the blood returns. So systolic and diastolic are the two terms we use to identify the blood pressure parameters.
You mentioned something about medication. Are there medications if my blood pressure is, let's say, 158 over 92, and I'm finding myself really on blood pressure medication, but it's ineffective? What should I do? Are all blood pressure medications, do they work the same? And how do I
Fortunately,
know when I need to change?
Fortunately, I've been around for a long time. And
Mhm.
I remember when we only had 2, 3, or 4 blood
Oh,
pressure
wow.
medications. Now we have at least 20 different medications. So there's no reason why anyone should have high blood pressure and not be treated by a medication. Now, here's what is the big problem with the blood pressure medications, especially as it relates to men. One of the common side effects of some of the medications that are best for high blood pressure is that it decreases your ability to have an erection or have a hard on, as they said in the street. And this is why many men early on wouldn't take their blood pressure medicines because it would have had a side effect. Now we have so many medications that there's no reason for you. If you have a side effect, tell the doctor and switch the blood pressure medication to a medication that doesn't give you the side effects that you are not happy with. But all of them have some side effects. But I think the interaction between the patient and the doctor, the healthcare provider, makes a difference. And the more frequent you have that, and the more effective it is, because it's not the fact that you're taking medication, it's the fact that you're controlling your blood pressure. That's the main issue. And if it's not monitored and don't have it controlled, then you're at risk for heart attack, for stroke, and
Stroke. Yeah.
kidney disease.
Hmm. So here's the thing, real scenario that I like to pose to you. Let's say you have some abnormal weight gain. Let's say around 60 plus pounds over a 3 month period, and you ruled out thyroid. You know that you have high blood pressure. Um, and now you've eat vanilla ice cream, or you need eat some other stuff that you probably shouldn't eat, but not to the tune of 20, over 20 pounds a month. What other tests should one take, and what do you do about these situations?
The real truth of the matter is that it's not that you'd like to say it's exogenous, it's outside of the body. But
Hmm.
the truth of the matter is, in 90% of the cases, it's you and what you eat and how you eat and the portions of food that you eat. And so the best advice is to eat a healthy diet.
Hmm.
And when I say that, we like to eat food that is processed. Well, that's one of the biggest obstacles to good health. The more you cook yourself, the more you eat your own food, the more you eat unprocessed foods, the better off you are. The less salt you have, the less sugar you have, the more fruits and vegetables you have. Yes, lean meat is desirable, but far too often we eat meats that aren't lean, and they're full of cholesterol, lipids, and other things that are not good for us. And
Hmm.
so, although you'd like to look for outside sources, the main source is you, what you eat, whether you meditate, whether you exercise. Those are the things that will make the difference, along with the medication that you may take.
Yeah, how long should you meditate a day? I try to pray all the time.
I
So
think the minimum is the same minimum that we say 150 minutes a week is the minimum for exercise and for meditation. Uh,
concurrently or independently?
it doesn't matter. Oh no, I'm talking about individually. In other words,
Individually, yeah.
150 minutes a week for exercise, 150 minutes for meditation.
All
I
right.
think you're right. So I think that those are minimum figures.
Yes.
I think if that's all you do, I don't think that's enough. But that's the least number that you should do every week in order to be minimally healthy. And then, of
150
course,
minutes.
as I mentioned, it's the type of food that you eat and the portions of food that you eat, and then, of course, the amount of salt and the amount of sugar, and so that getting to a situation in which you're eating a lot of fruits and vegetables and less meat is very healthy. Uh,
Less meat. Okay.
Less meat. The less meat you eat, the more vegetables, the more fruits, and the less meat you eat, the better off you are. And the less processed foods you eat, the better off you are. The
Well,
reason that we say that is because most times the processed foods are done to keep them from deteriorating, but
sure.
but they use a lot of salt, and salt, of course, especially for people of color, is associated with high blood pressure, as well as causing other ways in which it leads you to have other diseases, as well as high blood pressure.
Wow. So, i- when you talk about eating lean meat and eating less of it and more vegetables, more fruit, there are a couple of things that come to mind. One, in Western society, it seems as though we tend to eat more and more meat, and then the vegetable becomes your garnish. You're saying to reverse that.
Absolutely. And for those who would like to have some things mentioned, things that are good for you are chicken breast, for example, cheese, yogurt, lentils,
Yeah.
beans, nuts. Those are the kinds of things that rich in protein, but
Mhm.
good for you. They're healthy, and they're not associated with giving you those high cholesterol levels that are associated with arteriosclerosis. Sometimes we haven't appreciated the importance of beans and those kinds of things. We also eat far too much salt in our food, when in most instances you can use other things to use in place of salt, which will keep the food just as tasty as it was before.
You
But these are just a sampling of the kind of things that we need to do. So eating healthy becomes a major portion of it. Something we don't speak much of when we talk about exercise and meditation. We don't talk about the need for 7 to 9 hours of sleep, which is an
mm,
important aspect of it. We tend to overlook the fact that 7 to 9 hours of sleep is desirable for the brain as well as for the other parts of the body. You know, your muscles need rest as well as your brain. And so this is an aspect of good health that we sometimes overlook.
you know, that just brings me to another question. You mentioned vegetables. Two questions with regard to that. Number one, le- do we have to be mindful of the sugar in those vegetables and fruits? And number two, what vegetables are those that are adequate for protein? Lentils or what have you. What else?
Well, one of the most important aspects of it is that we tend to think of meat being great for protein, which it is, but we sometimes don't appreciate that the vegetables that we mentioned before, for example, eggs have plenty of protein in them. The fact that when we talk about yogurt, it has plenty of protein. Milk also has protein, even though people of color have more lactose deficiency. But I think when we look at what kinds of vegetables, I think you'd be surprised how green peas, corn, and some other green vegetables, spinach and broccoli, those are vegetables that have protein in them, and they make up for those people who think that you need to have meat. So those are some of the vegetables that are particularly good. As far as fruits are concerned, it's the jackfruit, which seems to be the one that is the most protein associated with it. But if you talk about tofu, soybeans, green peas, oatmeal, uh, sweet potatoes, and even potatoes,
Sure,
those are
sure.
some of the things that make a difference. We talked about uh, spinach, chickpeas, nuts, and sometimes we forget the value of peanuts and almonds and walnuts. Those are things that we may take for granted. And then, of course, recognizing that there's a place for spices and herbs that can be used to substitute for salt and make the food taste great in spite of the fact that you don't use much salt. And I
That's
think you mentioned something that I may have overlooked in answering the question, and that is the role of sugar. And it is very clear now that salt may be number one, but sugar's a close second
close
in
second. Yes,
terms
sir.
of causing ill health in our diets today.
So just quickly, we had from our audience, we had a question, and I think it's very appropriate. It says, "How do we get away from fruits and vegetables without, that are covered with pesticides?" And then they follow up with, "Are nuts good for gut health?" So, what do we do about all of these preservatives, the
Well,
pesticides,
now you hit on
all of these things?
on a very tough subject because we know that the pesticides are not good for us.
That's
They
right.
kill the insects. They also kill us. So
Yeah,
that
that's it.
that's why going to stores that have the vegetables that are free of the pesticides and the meats that are free of the pesticides is ideal. Unfortunately, there's a cost associated with that. And
Yep.
that's why in most of our communities, they don't have those whole health food stores because they
Yeah.
cost more. But that is in our best interest because the pesticides are killing us. You know, we have a high rate of cancer, and the high rate of cancer may be related to some of those pesticides that they use to make our vegetables better.
Well,
So
with the inorganic chemicals I used to use and that have gone into some of these things back in the day, it wouldn't surprise me. It wouldn't surprise me if they didn't cause cancer long term. Can you name some of the processed foods just off the top of your head? Because most of our grocery stores, right, have so many processed foods in them, whether it be the deli meat, whether it be uh any sort of thing, the frozen dinners, the all sorts of things in the breakfast section. Most of that's processed. And so can you name some? And then how do we deal with the cost of it? Because you already mentioned in our neighborhood, this stuff is expensive. So there seems to be uh, some ideals of racism, discrimination, all of those things associated that impact us economically, even as we're dealing with what types of foods we have in our community.
and you know the best remedy,
What's that?
this remedy is cook your food at home and
Cook
eat.
your food. What
Cook
about
your food.
growing your food?
How about that? Yeah, growing your food as well, and because once it's in store bought, they have to. Much of the stuff has to be processed to make sure it's preserved,
Yeah,
and those same preservatives are the same substances that are poisoning us today. So that trying to grow your foods or to uh, cook your food at home and eat at home and eat out as little as possible. It's probably some of the best advice that I could give you in terms of trying to live a healthy life and eat healthy foods. Is uh, try to cook your food at home and eat out sparingly. There's
sure.
some people who rarely eat out because not only the preservatives, but the people who prepare the food may not be as cleanly and as sterile as is necessary. So it's a good idea to have people to eat as much often as possible at home, and I recognize that any processed food and there's been a great cry out that the food that we eat is killing us,
That's
and
right.
in many ways there is merit to that.
Sure. Well, I do want to sort of shift from the food a little bit, and I'm grateful for all of the things that the folk are helpful in doing and putting in the chat, from eating bok choy to all sorts of other things, and just being mindful of the foods in grocery stores and what have you. But I know, Dr. Calendar, you are a world-renowned kidney transplant surgeon, and I just wanted to know about, if someone were to have a small lump on their kidney, would it be better for them to remove it or just don't touch it at all?
It is very important for kidney tumors that if the size is greater than an inch, that's just this, greater than an inch, then it needs to be x-rayed to find out the precise dimensions of the tumor, whether it's fluid, if it is an actual tumor, it is better out than in. And
Mm,
the larger it is, the more likely it is to be a cancer. If
I
it's a
see.
kidney, if its size is greater than an inch, then it needs to be removed, and it is presumptively a cancer. And cancers, of course, kill you. Now, if it's a fluid, and that's why you get an MRI. If it's fluid, that's different story, because if
Sure.
it's just fluid, then you don't need to do anything. But if it's actually a tumor, and if it's greater than an inch, then it needs to be removed. Whether you get great X-rays to identify whether it's fluid or whether it's an actual tumor. But if it's a tumor and it's greater than an inch, it needs to be removed. And nowadays, you don't have to take out the whole kidney. You take out half of the kidney most of the time if it's less than an inch or two.
Okay.
But if it's greater than an inch or two, then you may have to do a total nephrectomy. So catching it early and having it removed means that they don't have to take out the whole kidney. And if it's benign, they may not have to do anything else with it.
So,
But it is important to really get an MRI to find out whether it's fluid or it's a real tumor and the size of the tumor. And if it's greater than 2 inches, it's more likely to be a cancer.
okay. 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 Um, what if one of your kidneys is just totally gone? It's pretty much dead and it's in your body. What do you do?
It depends. If you have infection with it,
Mhm.
then it may need to come out.
Okay.
If you have no infection, then you have to pray that that other kidney is working well, because many people are born with one kidney and
That's
they
right.
live perfectly normal lives. So all you need is one good kidney for life. But I think that is something that is easily determined these days by having X-rays as well as blood tests to identify the
Yeah.
extent to which your kidney is normal or abnormal.
So if someone were in stage 3, how could they prevent further kidney failure?
Well, I think what you raise is something that we like to harp on, and that is that the 5 stages of kidney disease, and the first three actually are reversible.
First
Uh,
3.
First three, and the way you reverse it is by losing weight, normalizing your blood pressure, getting your blood sugar normalized, also monitoring it. Get urine screens and follow it and find out if you are doing those things that are healthy. I just spoke with a lady who had a GFR, which is a stage 3, and she had decided to eat healthy foods, lose weight, normalize her blood pressure, get her blood sugar normal. And as a consequence, she went from below 60 to above 60.
Oh, wow.
So that if you can drink a lot of fluids, uh, normalize your blood pressure, keep your blood sugar normal, and keep your weight at a good level, these are the ways that you can keep you can regain your kidney function and prevent from needing to go from stage 3 to stage 4 to stage 5. Now, one of the things that I would mention to you is that when you're in stage 3, you don't have any symptoms.
Yeah.
So you may not even know that you have kidney disease, and that's why it's important. You know, we spend a lot of time, the Ron Joe Paul Center, Kidney Center, spend a lot of time going to the community and screening. And the reason we screen is to see if you have protein, because that's the earliest sign that you may have kidney disease. And if we can pick it up early in stage 3 and stage 1, 2, or 3, then we can do those things that are necessary to normalize it. Get your blood pressure control, blood sugar, lose weight, exercise, sleep, and drink a lot of fluids. And we can reverse you from stage 3 to get you up to stage 2 or stage 1.
Okay.
Stage 4 and 5, you're in a stage where you need to take steps to stabilize what you have and prepare for the fact that you may need dialysis or you may need a kidney transplant in the future.
So talk a little bit about, when dialysis is possible, and even throw in, in your answer, we have a lot with regard to COVID. Can you just look at how COVID impacts, the kidneys?
Well, it's interesting because COVID is another cause of kidney disease. And many patients who didn't have kidney disease before they got COVID developed kidney disease thereafter and then now are in dialysis. And some have had to receive kidney transplants. But when you have a creatinine, when you have a glomerular filtration rate that is less than 20, that means that you are going to have to be on dialysis or get a kidney transplant. One of the things that is important to emphasize is the sooner you get urine screened or blood tests to find out whether you have kidney failure or not, the better off you are. Because as you mentioned, one, we can reverse some of the forms of kidney disease, but also you can stabilize and delay the need for dialysis and transplantation. One of the things we talk about with kidney disease is that it's a silent killer. And until you get to stage 4 and stage 5, you don't have any symptoms at all.
That's
And
right.
so, therefore, it means that you need to get urine protein screens. And after you get the protein screens and find out whether you're losing protein, to then do the genetic tests or whatever other tests that are important to find out why you have that loss of protein and what we can do to minimize that and normalize you. So that there are steps that can be taken, but it's important if you have protein in your urine that you see a kidney specialist so you can know what is best to do to prevent yourself from needing dialysis or a kidney transplant.
Sure. So, what if I have other comorbidities? Am I a candidate for a transplant?
Well, one of the things that is clear is that unless you have an active infection or active cancer, uh, you can be transplanted. Now, of course, the other thing that you have to be able to do is to be able to survive surgery. So you, of course, have to have a good heart and good lungs. But in the absence of active infection and cancer, those are the contraindications to transplantation.
Okay. Okay. You mentioned GFR. It does that differ as it relates to race?
It's clear to me that it doesn't, but in the past, they have used it as a oppressive factor to make it appear as though uh, the race makes a difference. That has never been my feeling, in spite of much of the literature in the old days that seemed to suggest it was.
I
But
see.
nowadays, that has been eliminated. And so the glomerular filtration rate goes from 100 to less than 20. And the closer you are to 100, the better off you are. The closer to 20, the more you're likely to need to have dialysis or transplantation. When we talk about dialysis, there's a number of types of dialysis that
Sure.
can keep you alive. You can have peritoneal dialysis, which may be the treatment that is more associated with getting you closer to health than anything other than kidney transplantation. And then there's hemodialysis, where they go into the blood vessels and purify your blood by that reason. But the problem with hemodialysis, you only do that 3 hours a day, maybe 3 times a week. Whereas you and I, our kidneys are working 24 hours a
24
day.
hours, 7 days a
And
week. Yeah.
so with peritoneal dialysis, though, you can have treatments for as much as 12 hours a day. And so people are closer to normal with peritoneal dialysis often than they are with hemodialysis. But
Yeah.
both are treatments that keep you alive. Of course, the treatment of choice for kidney disease is a kidney transplant.
Right. And one is done at home and one is done sort of at a center, right?
Well, it depends. You can do you can do home hemodialysis or home peritoneal dialysis.
Hmm.
Uh, but but if you don't have the sterility, the cleanliness, or people at home to help you, and most people don't, they then have to go to dialysis centers and get their treatment 3 hours a day, 3 times a week.
I
But
see.
that is clearly suboptimal. But it's probably the commonest way that people do, because they can go to a center and have somebody else take care of them. But here again, uh, if you can do it yourself at home by peritoneal dialysis, if that works for you, that may well be the best treatment choice.
Okay. I did have a few questions that have come into the chat. Folk wanted to know back to blood pressure. There's sort of uh, things that folk really want to know. One is what's a good high blood pressure number? I think you've answered that. If you have high blood pressure, is there a number that's better than Another, I think you said, what was that? 1/3, less than
130 over 80.
over
Yeah.
80.
Yeah.
Yeah, I think that's. But does high blood pressure ever just go away?
No, not to my knowledge.
Okay.
Well, let's put it this way. If you adopt healthy lifestyle changes, it,
Yes.
it can. It can, because that means that you start eating healthy, that you start uh, exercising, you lose weight, and you eat good food, healthy food. That is not, you eat less processed foods, and you eat less salt, and you eat less sugar. So it will go away if you do those things. If you change your lifestyle,
Oh, we're
it will go
losing you a
away.
little bit, Dr. Calendar. I
Huh?
think your screen froze a little bit.
Oh, okay. Uh, but so adopting a healthy lifestyle will cause changes. But if you don't do anything about it, it will kill you. You know, the
Sure.
number one cause of death in the world is cardiovascular disease,
That's
heart
right.
disease, stroke. All of those are contributed to by high blood pressure. And so, if we could do one thing to help mankind, it would be to keep your blood pressure normal.
Wow.
There are
And
other things to do.
and we're going to do that. I encourage everyone to make sure you keep your blood pressure regulated in appropriate ranges. You mentioned proteinuria when you're getting the urine exam so that you can determine whether or not you have what stage of kidney disease. What does that really look like? Is that bubbles on top of the urine that remain once you do the cycle? Does it, because you often see using the restroom some sort of bubble formation, but I think you're talking about an actual measurement of the protein in the urine.
Right, because frothy urine with bubbles is one of the first signs of kidney disease.
Sure.
Um, and so the way that you find out whether it is because of proteinuria is by doing a urine test. And that urine test will demonstrate whether your bubbles are due to the protein or not. And if it is due to the protein, then we need to find out why your kidney is spilling protein, because it should not
Sure.
normally.
Sure.
And so if you're spilling protein, that is one of the first signs that your kidneys are going to go bad. And so one of the things that we do once we find that out is to find out, what is your blood pressure? What is your blood sugar? What
That's
is
it.
your body weight? What kind of foods are you eating? And once we do that, if those do not tell us the answer, then gene testing becomes something that we must do. We also get MRI to look at your kidney size, see if you have cysts or other tumors or other things that are causing your kidneys to not work right. But if that doesn't give you the answer, sometimes you may need to get a kidney biopsy or have genetic testing, which identifies that you may have a genetic form of kidney disease. One of the things that we have identified is that people of color are associated with more kidney disease than other ethnic groups, particularly genetic. APOL1 is a genetic disease that if you have both proteins, and this is the same in Africa, they have a disease called sleeping sickness.
Sure.
And what protects the Africans from sleeping sickness is this gene, APOL1. And this same gene that protects you from sleeping sickness predisposes you to kidney disease. And so there is a genetic portion of genetic cause of kidney disease that we've got to eliminate as well. So that genetic testing is something that's relatively new that we do as a tool to be able to let us find out if we have genetic kidney disease.
Yeah. So here's one thing. Even with all of this testing that I hear that's recommended, even with the urinalysis, or even down to genetic testing, most insurances don't cover screening until you get to the latter stages.
That's the problem, and that's something that, as we do our screening, we do that for free. And
Okay.
so, as if we do the screening and it's positive, we then refer you to a nephrologist who who will then do other tests that will insurance will pay for.
So we need, every time we go to a primary care physician, we should not only be have our blood drawn, but we should also have a urine specimen so that we can sort of begin to know where we are with regard to our total health, particularly kidneys as well as the other things.
Especially if you're a person of color. It is clear that
Especially.
if you're over 40, then we are more likely to have high blood pressure and more likely to have kidney disease. And so for that reason, I think it is part of a responsible physician's obligation, if a person of color is over 40, that they should get protein, be tested for protein in the urine.
Okay. Okay. Well, you mentioned something earlier, and I think it's something we need to go back. You know, you talked about losing weight. You also talked about drinking water. But how does that, impact a person that tends to retain fluids?
Well, one of the things that we also talked about medication, and one of the things that a doctor can identify is if you are a salt retainer or you retain fluids. And we have
Exactly.
medications that will actually help you eliminate that water from your body safely. And so that balance in life is something that's very important, as you mentioned. And when your body finds that you've taken too much water, or rather you don't take in enough water, then sometimes that dehydration will negatively affect the kidney and cause you to have swelling, which we call edema.
Yes.
And this then is a sign, one of the earliest signs of kidney disease. Kidney disease. It's also a sign of heart disease and of liver disease. But swelling is an important early sign that your kidney, heart, or liver may be abnormal.
Okay. Well, one of the things I did want to also ask is, and this is a very, very great question that causes some thought. You know, when you talk about alcohol consumption, can you speak to that, you know, with regard to a dialysis patient? Should dialysis patients drink, right?
Uh,
Consume alcohol?
there's an interesting perspective. The Bible says a drink is good for the stomach's sake.
Yeah, have a little wine for the stomach's sake. Yeah, I hear you.
Yeah, so that most people will say that a glass or two a day of alcohol or wine is okay, and it's not going to hurt the kidney patient either. But I think the problem is that if you have alcoholism, one drink takes you all the way.
Takes you
So
to another place.
so I personally think that avoiding of alcohol is probably the best. Just like with smoking, avoiding smoking is the best. So my feeling about alcohol is that since there's potential of alcoholism, where if you take one drink, you must take 20, that the less you rely on alcohol, the better.
The less
And
reliance upon. Yeah, okay. Well, thank you for that, and thank you for definitely sharing. Um, One of the things is in our body, as we talk about the kidneys in particular, we can talk about kidney stones, right? As we talk about kidney stones, um, what about the acid levels in our body, um, and how are they related to these formation of kidney stones? And should there be, acid in the kidneys? Um, that's a very powerful question.
yeah, the basically we should have a normal pH which is not acidic, uh,
Right.
and we should uh, try to keep our bodies as free from acid as possible. But we know that there are people who are stone formers,
Mhm.
and we know that there are people who have diseases in which stones form. So hyperparathyroidism, people who have kidney disease also form stones as well.
Right.
And then there are disease entities in which the diets and the liquids they take result in them forming oxalate and calcium stones. There's nothing quite as painful as pregnancy or a stone in the kidney. And trying to pass that is one of the most excruciatingly painful situations you can have. And so avoiding an acid diet is critical. But there isn't much evidence that you can affect the predisposition to form stones, because there's so many different types of stones. You got uric acid stone, you have calcium stones, you have oxalate stone, you have other kinds of stones. So that diet alone often is not the remedy, because those people who are stone formers, one of the best things they can do is to keep drink a lot of fluids so they can wash out stones as soon as they form.
Well, I also recommend that folk know what their health profile is. One of the ways of doing that is doing things like Lifeline screening, lifelinescreening.com. There are others that are like Blueprint for Wellness. There are tons of others that folk need to know what their numbers are. And this empowers our people so that we can begin to be our own advocates when it comes down to our health. I did want to give you a real scenario. There's a woman that has a breast removed approximately 20 years ago, and she's been told that she can't have a live donor or be a live donor. Why is that?
Oh, okay. If she had cancer, let's presume she had cancer 20 years ago. She is now free of cancer, and
Right.
there's no reason that she can't have a live donor or be a live donor. Because if you're free of cancer for 5 years or more, and you have no evidence of active cancer, there's no reason why you can't be a donor or receive a transplant from a donor. So that I would suggest that she go to another transplant center, because that is not in keeping with the most recent information.
I see.
And of course, you said had a breast removed, but you didn't say cancer. But I'm presuming that it was cancer.
It was cancerous.
And so 5 years, after 5 years, and as long as you're active, you're negative for any active cancer, there's no reason you can't receive a donor or be a live donor.
Wow. So in another situation, a person has been referred to see a kidney doctor, in the next month, and they feel that all the medication they have had from the doctors putting them on since 2019, they say now they have EFGR is now very high. What should they be asking their doctor? How should they be engaging around this situation as they've been going to see a kidney doctor for help, and now what's happened is they seem to have a EFGR that is high?
Well, EGFR is high is normal. You see, the closer to 100 you have, the better off you are. Now, the question is, do they mean EGFR or do they mean BUN or creatinine? Because if the BUN is going up, then that means kidney disease. Or if the creatinine, that means kidney disease. But if the GFR is going up, that's what the doctor wants, because the closer you are to 100, the better off you are. So that maybe, but I would answer all of the questions to say that an EGFR that's going up is good for you. But a BUN that's going up is not good for you. A creatinine that's going up is not good for you. Protein in your urine is not good for you. So those are some of the things that they would need to know. Also, what is important is the baseline. In other words, where did you start from? What was your EGFR when you started off? What was your BUN when you started off? What was your creatinine? Did you have protein in your urine when you started off? So these are the kind of questions. And then, of course, you had mentioned early on that, knowing your baseline health, your cholesterol, your blood sugar, your hemoglobin, A1C, those are parts of you that you should know as well as anybody else, even more so than your physician.
Well, I know we're running out of time, but I did want to begin to talk about COVID just a little bit more before we have to exit. And right now, we're seeing some spikes in various places with regard to COVID. We're also in the throes of flu season. Should we take the flu shot and the COVID shot? Should they be combined into one shot, and we just sort of take them, or should we take them uh, um, sequentially after one another? How should that be navigated?
It is now clear that you should get two different shots, but you get them in
Yeah.
the same sitting.
Yes.
Because getting a COVID shot and the flu shot at the same time independently is good advice. Because especially it's a little late now because you should have gotten them a couple of months ago, but better late than never because it's right with us now. And we're having more hospitalizations and mortalities from COVID as well as the flu and from RSV. And we've got 3 vaccines. So you need to get all 3 vaccines. You can't get all 3 of them together, but you can get the flu and the COVID vaccines together. Independent needles, but still at the same sitting. So it is advisable to do that because now it's time for us to see the hospitals full again with people with respiratory infections.
Yeah, yeah. The RSV is another thing that we're seeing spikes in DC. I do, Dr. Callender, want to ask, if there was a summation or some comments you would like to have with this amazing group of folk that have joined us online. I just wanted to make sure that they had opportunity to hear from you in terms of a summation statement of what we should do. And in your summation, tell them how they can follow you on social media and what have you. I know that we can follow Kidney Talks with the Ron and Joy Paul Kidney Center on blackdoctor.org. Regular show. You can always look us up there. But one, what would be your summation statement? And two, how do we begin to follow you and learn more about this brilliance of a Dr. Clive Callender?
Thank you very much. I think in some, I would say that I hate to say this in many ways, but we are what we eat. And I think that the more we pay attention to what we put into our bodies, the better off we will be. And when I say that, I am saying that the less salt we eat, the better off we are. The less sugar we eat, the better off we are. The more water we drink, the better off we are. The more fruits and vegetables we eat, the better off we are. The less meat we eat, better off we are. The more fish we eat, the better off we are. So that look at your labels when you go to the drugstore. If there's a lot of names, it means there's a lot of processing. And the less processing you have, the better off you are. Yes, I'm emphasizing again, eat at home. The more you, as Dr. Curry said, the more you grow your food, the more you eat your food that you cook at home, the better off you are. The less times you go out to eat, and it's okay to have it as a delicacy, go out once in a while. But really try to emphasize making the biggest portion of your meal, not the meat, but the vegetables. And recognizing that vegetables and fruits and nuts are our mainstay. And then, of course, 3 things that I harp on. I harp on meditation, exercise, and sleep. I think those are the things that can help you as you age. Of course, one of the most important things is to have the gift of God's blessings.
Yes, sir.
because I'm now 87 years of age and
Look at
still at
that.
it, pain-free and sound mind. None of this is related to me. It's related to the gift of God, God, and trying to live my life for His glory. That I think has helped me to be here today. And so I say that following me, MOTAP, National MOTAP, is a program that I started actually 32 years ago. And MOTAP exists still in five states. And following me we have a MOTAP website, and we are so eager and anxious to share loving yourself, taking care of yourself, which is MOTAP's motto.
Well, this is just tremendous. It's awesome. Every time I hear from you, I'm blessed. Even as a pastor that has a lot of stress, and someone in the chat said we need less stress in our lives, and I know that God will, because I sit and meditate. I take my time and do so, and we have wise sages like you, and I just can't believe you're 87. I think you got those numbers turned around. It must be 78 at best, if not even younger. So
1936.
wow. Thank you. This is tremendous. And you're showing us how to eat, to live, and how to eat. We are what we eat, and how do we live. And so I'm grateful. I'm grateful, Dr. Callender. Thank you so very much. And for you who are with us, always tune in to Kidney Talks with the Ron and Joy Paul Kidney Center at George Washington University. I'm Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church in Washington, D.C. And we always have Dr. Clive Callender of MOTEP, Minority Organ Tissue Transplant Education Program, and is a premier surgeon still practicing at Howard University. He's a professor of surgery there. It's just awesome to have been with you. Thank you for allowing us to bless our community by sharing some relevant information that's needed for just such a time as this. God bless you. Have a wonderful holiday weekend of Martin Luther King Day of Service, and we're just looking forward to you joining us again. Be well. Take care. May heaven smile upon you. Bye-bye for now.